my dear international educated nurses. How are you doing? I know I've been away for quite a while, but let's talk about BCCNM registration. What are the pros and what are the cons? And I know a lot of people seem to think that BCCNM registration is one of the worst. I personally think it's one of the best because you get assessed. You get an assessment. The assessment is called Global Global Inspire Global for nurses. So you get assessed, and honestly the courses that you get after that, after the assessment, it looks as if it's a waste of time, or it might even look like, why do I have to do all these courses? I have my degree, but I'm speaking as someone that works in the hospital. I work in the hospital. I'm a nurse at the hospital, but I also work in a mental health institute. So let me speak as a nurse that works in the hospital. Honestly, certain things are just different because it's a different country, it's a different place, it's a different hospital. So some of the things that I've realized that are different, let's say how the doctors write their notes, it's different. You might read, it might take you, for example, longer to interpret the message of the doctor as another nurse will take, just because you were educated outside of the country, that you did not learn, you did not start learning that kind of reading when you started your nursing school. Maybe this is just a simple example, but certain things are just different and you need to get adjusted. You need time to adjust to do all those things. So that's why I think that for you to be assessed and get courses is not a bad thing. It is for them, for BCCNM, the nursing college, to make sure that you are a safe nurse, that you are able to provide care to the best of your ability, but that your patient is safe and you are also safe while providing care. You understand? I hope this does make sense for you. You understand? So the process with the BCCNM, it starts with you applying to the college. After applying to the college, they will send you to Global, to the Inspire Global, which is formerly known as NCAS. So what is the most difficult thing about the preparation is that there is no information out there, unfortunately, that can prepare you to do NCAS or the Inspire Global. There's really nothing out there because you are being tested for nursing knowledge. Let me put it that way. You are being tested for nursing knowledge. So there's nothing, absolutely nothing out there that can prepare you. There are some courses where that they require probably $1,000. Someone was asking $1,500 when I was preparing for my my assessment. But on my, it's a skills assessment, and it's also a competence assessment, because you have a computer test, a CPT test, but then you also have, of course, skills lab. You also have a test where that you can show how you were able to do how your skills, like if you are able to do skills, if you are able to try to give medication, like any nurse, like it's part of your nursing journey, or part of your nursing education. um what I would advise people who are getting ready or who are hoping to get registered in BC is prepare your nursing knowledge according to the Canadian education, which is not easy because you're not an international educated nurse. So I'd say prepare. This a course that is offered by KPU, the Kwantlen University. It's called that course is called Nurse Ready. I think it's about $2,000. It's a lot of money, but if I wanted to spend money on anything to prepare myself, that's like the best course I would choose. um I am saying that out of experience. I did both. I did not do the nest ready before my skills test, before I did my assessments with Global Inspire. No, I did the course after. But I think that if you do that course, it would prepare you to probably what you would see at the assessments. I can't really talk about what is in the assessments. I believe they change it. I hope they do change it after some time. But when you're doing the assessment, you do sign non-disclosure assessment. So I can't really talk about it. However, I can help you. I can tell you which things might be able to help you. So one of the things would be that course. If you do that course, I believe you don't even need to buy the book, The Sanders. I think you all know the book Sanders. That book is amazing. So I'll just probably link it in the bio. Then you can buy whenever you are. But that is an amazing book. So if you're able to buy the book Sanders and read through it, do your exercises. If you are able to go on a website and do some NCLEX questions, that would also help you. And if you are able to do the course Nurse Ready, definitely that will be a plus, and it would help you. It won't only help you just for your assessment, but it also help you when you start studying, working, when you start working as a registered nurse or a registered practical nurse, whichever one that you get after your assessment. It will really help you. I have people who are struggling to get a job because they transferred their license from Alberta and they just brought it here. Those people are struggling to find a job here just because they transferred their license and they do not have any Canadian experience. I also have people who were lucky enough to get a job, but you can see that at the job they're struggling. Honestly, they're struggling with the assessments, they are struggling on knowing medications, they are struggling just because it's a different, you come from a different country, a different continent probably. So the nursing that you know back home is not the same as the nursing that you're going to practice here in Canada. And this is why I will not get tired to emphasize this. Um, you need to know your stuff. You need to know your nursing knowledge. You need to at least get something that will put you maybe not on the same level that as a new graduate in Canadian nursing, but at least that would put you a little bit lower than a new graduate, but that at least will give you the certain knowledge on how assessments are done. In some countries, for example, where I come from, we do not do assessment. We do not do listen to bowel sounds. We do not listen to cardiac sounds. We do not listen to respiratory sounds. Like those are things that I came to learn. And if I did not learn all those things, I would be listening to those sounds and be like, okay, I can hear them breathe, but yeah, do I know what I'm listening to? Exactly. So those seem like very simple things. Or wound care, how do you do wound care? I've seen people going to do wound care, they don't have a wound care set, they do not have any cleansing solution. I'm like, okay, you're doing wound care, so what then? Are you just gonna take off the bandage and then put a new one back? You need to cleanse your wound, you need to work, you need either to use a clean technique or you need to use a sterile technique. So those are things that might vary from one country to another, and I cannot emphasize this enough. Learn those things. And if you are getting ready, preparing to get registered in BC, please just leave me a message or go to my YouTube channel. It's called the Kapinga Family, and then, link me up, DM me, send me an email, and I will guide you through. if you have any other questions, just leave them in the comment below. Or if you need me to comment on something particular, NCLEX, how to get a job after you done all the things, I really got a job like 2 months after I got my registration. So if you are in any of this, just link me